name's Ava Solberger, and September is Suicide Prevention Awareness Month. And in honor of that, we are going to talk to 3 families who have lost loved ones to suicide. On the trumpet is Paul Branagh, a talented musician. About 5 weeks after this video was filmed, he took his own life. Paul was 24 years old.
Suicide can happen to anyone. Nobody is immune from it. No family is immune from it.
Well, depression and mental health problems in general can affect absolutely anybody. And I think we as a community do better to acknowledge that all of us struggle to some degree with having optimal mental health, and we all need to work very hard.
I am somebody who is open about the struggles I've had. That's part of overcoming stigma and discrimination, when people realize this is my neighbor, this is my friend, and they are a person just like me.
We all need to talk about our depression when we feel it, or wear it right on our face. That's one reason I came forward, and I wanted to talk about it because I guess I wished there had been more talking when she was depressed.
It's hard to know that your loved one was in pain, and either you knew or you didn't know, but they thought that their only way to get out of their pain was to end their life.
One of the messages I'd like to get across to people who are struggling or their family members is that the help is out there. We want to help, we want to intervene, and that there are things that can be very effective.
I think it has to be all of us helping the person see that ray of light that they can't in that moment of darkness.
Suicide is a major public health problem. There's more people die in the United States now by suicide than die by car accidents.
Vermont has a higher rate of completed suicide than the national average. It is the second leading cause of death, especially for young people and young adults.
So we're the healthiest state, we get all these awards, and yet
we have this side of our health that's not so good.
What's driving a lot of suicide, maybe most of suicide, is the presence of a psychiatric illness like major depression or bipolar disorder. And psychiatric conditions carry a lot of stigma in this country and elsewhere. And if you think about the number of people who die by suicide, the number of people who attempt suicide, it's an extremely big public health problem, and we need to devote more resources to it.
This is Paul's trumpet, one of many Paul's trumpet, but this is his favorite trumpet. And it was like an extension of himself. He just always kind of had it next to him. So we keep it right up here. I think Paul just liked the freedom of jazz. He loved his family. He and I were, very close. Very close until the very last moment that I saw him. This is a bike gear, because that was one of Paul's favorite things next to his trumpet, was to cycle. In retrospect, I think Paul did have depression. And he never admitted it to anybody, he never told anybody, at least he never told us. He always kind of put on a different face. This is the most puzzling picture in a way. So you can kind of see how I was not thinking of how troubled Paul was, because this is only 3 weeks before he died. One of the last things he texted me is, "Mom, I love you." Yeah, Paul had passed away that night. We were shattered to almost like a numbed silence. It was just everything to us. We set up what was called the Paul Branagh Memorial Fund. Every year, a certain amount of money is allocated through the Discover Jazz Festival to supplement the jazz education that's going on in the Vermont schools right now, keeping Paul's memory alive in the community, and also keeping jazz alive.
He is obviously still here with you.
Paul is still here with us.
One of the tricky things about suicide is that many of the warning signs are relatively nonspecific. Most people who have some of these signs do not go on to be suicidal. But some of the things that we look for are someone becoming much more isolative, maybe using more substances than they usually did, certainly giving away things.
I read a lot about suicide since Paul passed away, and some of the things were just the biggest red flags. So these risk factors of underlying depression, drug or alcohol abuse, his risk-taking behaviors, his impulsivity. People that get to that point, they have blinders on almost.
That is when you're chronically depressed, you actually can't see straight anymore. You really can't. You completely lose sight, you know?
It's amazing how easy it is to hide the experience of severe depression, suicidal depression. It's amazing how you can put on that false face in public.
You want people to be able to recognize the signs and symptoms of suicide in their family members, their friends, their coworkers.
You need to ask, you need to follow up and say, when you say that, it really concerns me and I really care about you and I need to know. Are you thinking of hurting yourself? And are you thinking of taking your own life?
A father of 3 who was nicknamed the Mayor by his friends, Kevin Cunningham was 54 when he took his own life.
This is my family. We kind of have a joke with our friend. We go, ooh. So that's what I'm doing in that picture. My father's name is Kevin Cunningham. He was always smiling, always so happy. He was kind of like everything to my family. You know, he was kind of our rock. He was kind of our go-to guy. My family is from Huntington, Vermont. I'm the youngest of 3 kids. He had a very funny, weird, contagious sense of humor. His hobbies were spending time with friends and family. Made it to his 50th fish show. He loved coming to Bolton Valley. That was his favorite place. My dad passed away through suicide. It was very sudden. Nobody could really expect it. He waited for me to graduate because I was only 19. To this day, I think it's still kind of a surprise or a shock. I think his depression was very silent. He used a lot of humor to cover up things. You kind of kick yourself for like not noticing the signs. If you look at my dad, he was the last person you would ever expect. We have a bench actually on top of Bolton Valley that says nothing left to do but smile, smile, smile. Like there's nothing we can do to change what happened, so you kind of move on and think about the good memories. What I'm willing to try and what I encourage others to try is to listen to stories like mine and to listen to other stories and use it as an opportunity to kind of educate yourself. I think if we're aware about this disease, I think we might be more aware of the signs and the symptoms.
Stigma remains the leading reason people don't get help when they want and need help.
I've lost my dad, but I've also lost, there's been people in my community who have committed suicide. If it was like cancer, I think people would be more willing to talk about it.
So if you were having a problem with your heart, or you're having a problem with your kidney or your stomach, you think nothing of going to the doctor and saying, tell him all your symptoms, everything, and help me. So why not do that for your brain?
I was open about it because I was getting involved in advocacy and I thought it was critically important to be a voice that could say, look, I am one of those people.
A beloved law professor and a well-known legal commentator, Cheryl Hanna was 48 when she took her own life.
I saw the domestic Cheryl Hanna, the person that I lived with, was sort of all of the above. The public persona was always up on that high wire. And so, what a lot of people saw wasn't the whole person. That's true of everyone, but she was a little bit more of a person of extremes. Cheryl was the center of our family. She was sort of a cheerleader and very enthusiastic. She had this strong intellect coupled with a big dose of confidence. She was also really fragile. She began to have some fairly acute anxiety, and as we know, anxiety and depression are interlinked. She began to lose sleep, and at that point, and that's about the 2.5-month mark, at that point, she sought help. When you become so sick, you just can't see straight anymore. You'll be better off without me because I'm sick, I'm not well, I'm not the superstar mom you used to have. I'm like, I don't care, But she cared. And she cared so much that all was part of the spiral. And of course, because she was such a public person, she was sort of horrified at the thought that people would find out. She was suffering so much. And we all go to those places of despair, and we come out of them. And Cheryl would have come out of it too. It just needed time.
Despite everyone's best efforts, we're not going to be able to prevent every suicide. But what we do know is that many suicide attempts, even very serious suicide attempts, are quite impulsive. So if you can intervene, if there can be some kind of obstacle between the thought and the action, that can very often save somebody's life.
I don't think I ever wanted to die in the sense of wanting that as a choice, but I desperately needed to end the pain. I went through 3 or 4 years of in and out of the hospital, really very severe depression, and more than once dealing with issues around suicide seeming to be the only option, and on one occasion attempting to pursue that. The belief in the hopelessness of the pain and the depth of the pain, this vortex, the black holes, you do get better. It does get better even though you don't recognize that. And if somebody can help get you through that time period, then you can recover. But because you don't believe that, it has to be other people helping.
Reach out to somebody, even if it's a neighbor, somebody you try and connect with somebody again.
You're not the only one going through it, and you won't know that until you kind of talk about it.
Don't face this alone. Reach out. People want to help. Reach out.
Suicide can affect anyone. Depression can affect anyone. And if this is something that you're struggling with, please get help. Talk to someone, talk to a friend, a family member, a professional, but get help because there is hope and you will come out of this.